My grandfather was a case in that study. He worked as a firefighter where the Tuskegee Airmen trained. He and I were phenomenally close. The syphilis study happened for 40 years. Penicillin was found to be the most effective treatment, but the men were denied the treatment. Interestingly enough, I've had someone tell me that they were concerned about getting the vaccine because of the syphilis study. And I always, try to educate or provide some information about what happened. But then I said, you're talking about something that happened to my family. And I've taken both of my vaccines. I'm doing this for them. Health is greater than wealth, and it's really up to us to take ownership of our health and this story.
Good evening. Welcome to the Links Incorporated's Links in the Know COVID-19 Town Hall with the Surgeon General. I am Dr. Dee Banks, an infectious disease specialist with Northeast Ohio Infectious Disease Associates in Youngstown, Ohio. I have the pleasure of introducing our national president and leading a conversation with the Surgeon General of the United States. Leadership is an art form. Leadership during times of crisis is a masterpiece like no other. An effective leader during a time of crisis must show humility, be empathetic, provide transparent communications, act decisively, and be proactive, not reactive. Since the first cases of COVID-19 were discovered in the United States more than 18 months ago, this woman has done just that. Through her leadership, she has helped members of the Links Incorporated navigate the pandemic. From quickly establishing a COVID-19 task force to meeting with leading medical infectious disease experts, to hosting webinars and town halls like this one, she has provided information in an effort to dispel myths surrounding COVID-19 and the vaccines and to help keep people safe. A key to educating the public, particularly members of the Black community, about matters affecting our health is adding a face that looks like them and a voice that speaks to them on message. Our national president courageously and graciously embraced this role. Ladies and gentlemen, it is my honor to welcome the national president of the Links Incorporated, Dr. Kimberly Jeffries Leonard.
Good evening, good evening, good evening. It is my pleasure to welcome you tonight to our town hall. I am Kimberly Jeffries Leonard, National President of the Links Incorporated, and thank you, Dee, for that wonderful introduction. Dr. Dee Banks is a widely admired, highly touted infectious disease specialist. She is a member of the Youngstown chapter of the Links Incorporated, and you will learn more about her in our program. I am so pleased that she is here tonight, and I cannot wait for you to hear the conversation she's going to have with the Surgeon General. I'm also pleased to have all of you here tonight. Welcome to the audiences viewing this stream on the Black Women's Agenda Incorporated website, the Mocha Moms, the National Council of Negro Women's, and the Links Incorporated Facebook pages. And thank you all for joining us on Zoom. I want to applaud the agency over your life that you're demonstrating by being here. The coronavirus has touched so many lives and touched so many facets of our lives. Your presence here tonight is the type of collective engagement that we need to bring this pandemic to an end. To help us do just that, we have a dynamic group of guests with us for a two-part event. You've already met one of the Links Incorporated's national co-chairs of the National COVID-19 Task Force, Dr. Virginia D. Banks, who will sit down with the Surgeon General, Vice Admiral Vivek H. Murthy, for a one-on-one conversation about the current state of the coronavirus pandemic and address some of the most pressing questions that the community has. This intimate talk will be followed by a dynamic parent roundtable We will be joined by the following very special guests. Andrea Brooks Smith, who is the National President of the National Association of Colored Women's Clubs. Cornisha McGill Brown, the National President of Jack and Jill of America Incorporated, and a member of the Columbus, Georgia chapter of the Links Incorporated. Rashida Liberty, International Grand Basilisk of Sigma Gamma Rho Sorority Incorporated. Dr. Derek J. Robinson, Chair, Grand Strategic Planning Committee of the Sigma Pi Phi Fraternity. All parents, and our link member, Dr. Florencia Greer-Polite, Chief, Division of General Obstetrics and Gynecology and Professor of Clinical Obstetrics and Gynecology at Perelman School of Medicine at the University of Pennsylvania. From getting children vaccinated to booster shots to persistent vaccine hesitancy in people of color to prevailing myths surrounding the vaccine, our distinguished guests will tackle it all. Under the leadership of Dr. Banks and her fellow co-chair, Judy Carmichael Brown, a member of the Circle City, Indianapolis chapter, who you will hear from later, our National COVID-19 Task Force has worked tirelessly to bring members of our community accurate, timely, relevant information about the pandemic. I am so very proud of the work our task force has done and the hours they have dedicated to keeping all of us safe. The impact of their work extends far beyond the walls of the Links Incorporated. Now, before we get started, I'd like to turn the virtual stage over to two dynamic women leaders who have helped us pull this event together and who are very valued partners of the Links Incorporated. From the National Council of Negro Women, we are joined by Executive Director Janice L. Mathis. The National Council of Negro Women is an organization of organizations comprised of 300 campus and community-based sections and 32 national women's organizations that enlightens, inspires, and connects more than 2 million women and men. Its mission is to lead, advocate for, and empower women of African descent, their families, and their communities. And from the Black Women's Agenda, Inc., President Guinevere Catchings Hess is with us. The Black Women's Agenda is devoted to advancing, securing, and protecting the rights of Black women who are disproportionately represented within statistics related to poverty and who lack access to economic and educational opportunity. And they do this through their 24 national collaborating organizations. As you can see, our evening is power-packed. Thank you again for joining us tonight, which has been made possible by the generous support of the Ad Council, a nonprofit that has a long history of creating life-saving public service communications in times just like this of national crisis. And by the COVID Collaborative, which is a national assembly of experts, leaders, and institutions in health, education, and the economy, and associations turning the tide on the pandemic by supporting federal, state, and local COVID-19 response efforts. I also want to take a moment and extend thanks to our friends at the Joy Collective, a certified Black and women-owned strategic marketing and creative agency specializing in brand building and a force behind the Crown Act. Ladies and gentlemen, I hope you walk away empowered and informed to make transformational decisions about your health and the health of your family for the betterment of the health of our global community. At this time, I am pleased to welcome Janice Mathis and Guinevere Catchings Hess. Ladies, welcome.
Thank you so much, President Jeffries Leonard. It is indeed an honor and a privilege to be here with you and your guests this evening. I bring you greetings on behalf of Dr. Janetta Betch Cole, NCNW, and Good Health Wins, the Women's Immunization Network. We're hard at work, just as you all are, providing science-based information, inspiring vaccine confidence, and promoting health equity. And we could not have a more valued partner than the Links Incorporated. We are honored to be here with you tonight. We have important work to do. If there is a silver lining in the COVID-19 cloud, it is an unprecedented level of organizational collaboration and cooperation that has been required of all of us. As Dr. Cole might say, if you want to go fast, go alone. But if you need to go far, go together. We have far to go, my sisters, and promises to keep. So let's go together. Thank you.
And thank you, President Jeffries Leonard and the Links Incorporated for the opportunity to give remarks on this very, very important issue. As you mentioned, Dr. Jeffries Leonard, the Black Women's Agenda and its 24 collaborating organizations seeks to ensure that the rights of Black women and their families are taken care of in education, health, and economics. In the coming weeks, the Black Women's Agenda will partner with many of its organizations and UNICEF to look at the work that's being done about COVID around the world in Black communities and African communities. We will also have webinars on the effect that COVID has played on our mental health, and it has been challenging for all of us. You know, I grew up listening to the adage, your health is your wealth. And I thought as a young person, I hope there's more to wealth than just your health. But now that I'm older and have gone through winters and summers and many seasons, I know that my health is my wealth. Not only is it my health is my wealth, it's my family's wealth. It's my people's wealth. It's the nation's wealth. Health is our own personal infrastructure. So when we hear people say things that they have heard that are misinformation, disinformation, rumors, and outright lies about the vaccine, it is so disheartening. It is the pleasure of the Black Women's Agenda to be present with you this evening so that we can help dispel all the rumors in hopes that common sense will become commonplace. Thank you.
Thank you so much, Executive Director Mathis and President Catchings Hess. Your words were inspiring and right on point, and what leads us into our next conversation. Now, we are so pleased to welcome to this virtual stage for an intimate conversation, Vice Admiral Vivek Murthy, the Surgeon General of the United States, and Dr. Virginia D. Banks, who is the leader, as we stated, of the national co-chair of the Links Incorporated National COVID-19 Task Force. Vice Admiral Murthy was confirmed by the U.S. Senate in March 2021 to serve as the 21st Surgeon General of the United States. As our nation's top doctor, Surgeon General Murthy's mission is to restore trust by relying on the best scientific information available, providing clear, consistent guidance and resources for the public, and ensuring that we reach our most vulnerable populations. During his previous tenure as the 19th Surgeon General, Dr. Murthy created initiatives to tackle our country's most pressing public health challenges. He helped lead the national response to a range of health issues, including the Ebola and the Zika viruses, the opioid crisis, and the growing threat of stress and loneliness to Americans' physical and mental well-being. Dr. Murthy continued the office's legacy on preventing tobacco-related disease, releasing a historic Surgeon General's report on e-cigarettes in youth. Recognized for her expertise, leadership, and thoughtfulness, and concern for patients, Dr. Banks is a widely admired infectious disease specialist known for her dedication to the field and its future. A physician with the Northeast Ohio Infectious Disease Associates in Youngstown, Dr. Banks is the former director of infectious diseases at the University of Pittsburgh's Medical Center's Horizon Health System in Western Pennsylvania, where for 15 years, she was the only infectious disease specialist for 2 counties with extremely busy clinical services. She is nationally known for providing leadership and innovative solutions for infectious control in hospitals. She was the recipient of the Infectious Disease Association of America's 2019 Wordicarian Corn I think I mispronounced that, Clinician Award. We are now pleased to have this one-on-one conversation on the current state of the coronavirus with the Surgeon General and Virginia D. Banks.
Good evening. I am Dr. Virginia Banks, and this evening we are so happy to have with us the Surgeon General, Dr. Vivek Murthy. Dr. Murthy, good evening.
Well, good evening to you, Dr. Banks. Thanks for having me today.
It's a pleasure. Could you just maybe give us a few opening remarks about you and your office and where we are today?
Absolutely. And look, I'm really excited to have this conversation and just for the chance to hear some of the questions that have come from members, over the last many, many months. I know that we've been in the midst of a really challenging pandemic, and it's taken a toll on all of us. And my hope is that today we can answer some questions that have been on your mind and hopefully give you a little bit more peace of mind and a sense of at least where we're going. But before we jump into our conversation, I just want to say just what an honor, a true honor it is to be with you this evening. I've learned a lot about the organization in recent weeks and just so impressed by what you have built as members, the service you're providing to the community. And I'm just really inspired by your mission to be linked in friendship and to be connected in service, of the broader community. I think it's also, for me, it's very meaningful to be talking to you today, because when I look at the broader COVID response that we've had over the last 18 months, I see women of African descent who have led the way in many aspects of the response. Dr. Banks is one great example of frontline clinicians who have really served patients over the last many months. But we've also had women of African descent who have served as public health leaders, who have helped develop the vaccine, who are helping get those vaccines now to people and prioritizing equity in the process. Dr. Kizzy Corbett, who many of you know, is one such woman who's been an extraordinary contributor. She's one of the scientists who helped develop, in fact, one of the mRNA vaccines. And that is now protecting millions of people in the United States and around the world from COVID-19. It's also probably not much of a surprise that after the vaccine was actually developed and authorized in the United States, that the first person to step up and take it was a Black woman, Sandra Lindsay. And she said that her goal was, quote, not to be the first one to take the vaccine, but to inspire people who look like me. And it's also no surprise that when President Biden rolled up his sleeve to get the first dose, it was a Black woman, Taba Mese, who administered the shot and shared widely about the safety of the vaccine. So if you just look at it quite simply, women of African descent have been leaders in our pandemic response, especially when it comes to COVID-19 vaccines. But while there's been a sense of hope and excitement that surrounds the vaccines, I know that there's also been confusion and concern. And that's why it's really important to make sure that we're getting quality science-based information to you and to the communities that you serve. Your organization really embodies the belief that it's our connections with one another that can be one of the most powerful tools that we lean on during these times of need. It can be one of the most powerful motivators for us to step up and to serve one another. So I hope that we can take what we discuss today and share it widely. And I hope in doing so, we can remind people around us that their concerns and their questions really do matter. There's no shame in having questions and wanting to get answers to those questions. And what I'm hopeful that you can do and that we can do together is to cut through some of that noise of misinformation that surrounds us and to help other people navigate a choice around the vaccine that could help them stay safe. So I know we've got a lot of ground to cover today. I'm excited to hear your questions. And Dr. Banks, I'll turn it back to you so you can lead us to the next part of our discussion.
Thank you, Dr. Murthy. As you said, I am a practicing physician in the trenches. I just started this year, my 47th year in infectious diseases, and never would have imagined that I would be here in this pandemic. And shameless plug for my mom, who will be 104 on October the 7th, lived through the 1918 pandemic. So I guess I've kind of come full circle. I'm just going to jump into some questions now.
Well, Dr. Banks, I got to say, there are no shameless plugs when it comes to moms. We should always be holding up and celebrating our moms. What an incredible story about your mom. I'm curious, has she shared any stories with you about the 1918 pandemic? What you remember?
Well, the only story that I can share is she said, I was a year old then, but my mom did tell me this, that the doctors that drank alcohol and went into those houses were the ones that lived. So she said,
Oh my gosh.
so she said, maybe while you're taking care of patients, you should have a hot toddy in the evening. So, yeah. But yeah, she remembers the stories that, those were some of the few stories and she made it, she lived through it. So it's interesting and she's still very much with it. So yeah, thank you.
That's wonderful to hear.
So I'm just going to jump into these questions that we have today. And thank you so much for taking the time to do this. So, there over the last couple of weeks, especially, there's been a lot of conversation about and news about the booster vaccines. And I want to start out with that as a question. Considering the FDA last week made some recommendations and guidance in terms of the booster vaccines, can you comment on that in terms of booster vaccines for the general population?
Well, absolutely. And this is actually a great time to be talking about it because right now, as we speak, the FDA and the CDC are in the midst of making recommendations to the American public about booster shots. The FDA made its final recommendations. In fact, yesterday, the CDC is deliberating today on what their final recommendations will be. But if we look at, why this has even come up to begin with, it's not because the vaccines don't work. That's not why we're talking about boosters. In fact, the vaccines have worked remarkably well to keep people out of the hospital and to save their lives in particular. That's one of the reasons we're still urging people to get vaccinated. But what we want to do is to make sure that that protection is extended, that it continues, because we want to protect people from this ongoing pandemic. And we're dealing with the Delta wave right now, which is one of the most transmissible variants that we've seen to date. And so extending that protection will likely require third shots. And we opined on this, many of us in the administration earlier in the summer, because we were looking at the same data that a lot of other scientists were looking at that was indicating that there was starting to be a decline in protection against mild and moderate disease. And we were worrying that as time went on, that might, look like a decline in protection against severe disease and hospitalization. So we wanted to make sure that people had, again, an extension, if you will, for their protection. That's why these extra shots became a topic of discussion. It's also why other countries have moved forward with providing those kind of shots. Here's where we are right now. The FDA just yesterday announced that it is recommending these additional shots for people who got the Pfizer vaccine and who are at least 6 months out from their last shot. And they're recommending it for people who are at higher risk. Now, who's at higher risk? There are three groups that they outlined. The first are people over the age of 65. The second are people who have other medical conditions like diabetes or heart disease or even obesity. They may put them at higher risk for bad outcomes with COVID. And the third group are people who either work or live in a place where they have a lot of exposure or potential exposure to COVID. So think about healthcare workers, think about teachers and grocery store workers who may be seeing lots of people over the course of the day, many of whom may not be vaccinated. And so they also need some additional protection. So those three groups include millions and millions of Americans. And it's a step forward in my mind in helping extend protection to many of those, including people like you, Dr. Banks, who have been on the front lines helping to keep the rest of us safe. This will help us make sure that healthcare workers, among many other groups, are safe as well. So finally, the CDC is meeting today, and they're going to make an additional set of recommendations. On top of that, we're looking forward to seeing what they are. But this is the first step in a broader process. And as more data comes in about other groups, that helps us understand more about what's happening with their protection and whether they need an additional shot, the FDA and CDC will make recommendations accordingly.
Thank you. I think some people in the population who received the J&J vaccine sort of feel like they've been left out. And I think there's been some recent data over the last couple of days, for example, about getting a second J&J vaccination. Can you comment on that, please?
Absolutely. I'm really glad you asked, because the recommendations the FDA made yesterday were for the Pfizer vaccine. And the reason that they didn't yet opine on the Moderna and the J&J vaccines is because they got the data for Pfizer first. That's what they were able to process first, but they are rapidly moving now to getting the Moderna and J&J data processed. And we're hoping in the next few weeks that we will have a recommendation from them so that we can also extend protection to those populations. Because you're absolutely right. We have millions of people in our country who have gotten the Johnson & Johnson vaccine, who've gotten the Moderna vaccine. We want to make sure that they're taken care of as well. The good news is the data is now there. We can analyze it. The companies had put out some preliminary assessments showing that they believe that their additional dose did significantly increase protection. That's promising, but we've got to make sure that the FDA has a chance to look at that data, evaluate it independently, and then make their recommendation. I'll lastly say one thing just about the process of getting your third shot, which is the good news, is that we've now built a lot of experience over the last 8-9 months of this vaccination campaign, figuring out how to set up access points for vaccines, how to make sure that people can get them at their doctor, at local pharmacies, and at other sites in their community. And all of that is going to help us now, because the fact that we started doing the planning for third shots for boosters last month in August, that's actually what's helping us now be ready to deliver those additional shots to people in a variety of locations across the country. So all of that to say that this is the first stage, of third shots. There will likely be more decisions to come with Moderna, Pfizer, potentially with additional populations in the weeks ahead. So certainly stay tuned. But if you fall into those groups that I mentioned, just keep in mind that getting that third shot, if you're 6 months out, that'll be a good idea to help you extend your protection against COVID.
Do you think there'll be any information coming out about mixing the vaccines? For example, if you got Moderna, can you take Pfizer, vice versa? What do you think about that?
It's a really good question. And the short bottom line is yes, there will be more recommendations coming out about that. It's interesting to note that there are other countries that actually have already recommended or at least approved the mixing of vaccines. Canada is one, the UK is another. And what we have wanted to do is to make sure that our FDA, our Food and Drug Administration, have a chance to actually look at the primary data around mixing and to make an assessment of what works. Some of the other countries that have approved mixing, for example, of what's called an adenovirus vector vaccine and an mRNA vaccine, they actually use a different adenovirus vaccine than we do. We use J&J, they use AstraZeneca, and they found in studies that if you take AstraZeneca and you actually follow it up with the Pfizer vaccine, that people do really well. So what we want to do, since we don't use AstraZeneca, is we want to look at actually studies that are specific to what we offer here. So we want to look at mixing J&J with Pfizer or J&J with Moderna, mixing Moderna with Pfizer or Pfizer with Moderna. And the good news is that a lot of that data is already being collected. The FDA is standing by ready to assess that as quickly as they can. And my hope also there too is in the coming weeks that we will have data on mixing. I think that will actually help us a lot, not only to figure out what is safe and most effective for people, but it'll also logistically, I think, make it easier for folks, to get whichever vaccine, is available to them, so long as that's, proven to be safe and effective in terms of mixing.
Exactly. That's a big question. We have known for some time since the vaccines have come out that the communities of color, Hispanic and Black community has lagged behind in terms of immunizations. And I think I saw some information that came out that after September the 9th, there seemed to be some blip in the increase in the number of vaccinations given to the Hispanic and African American population, which actually was good news. But if we still look overall at counties and states in this country, African Americans, certainly and Hispanics, lag behind. So what is the plan to get more individuals in the African American and Hispanic community to get immunized? And what can we do as an organization of the Links?
Well, I'm so glad you asked, Dr. Banks, and because you brought up what I think is the most important determinants of success for us in this vaccination campaign, because it's not just how many people we vaccinate, it's how equitably we vaccinate our community. And look, there's certainly there's a dark side of this, right? We know that there have been deep, profound inequities in access to health and healthcare outcomes in our country for years, right? We know that communities of color have often been behind when it comes to accessing the advances, of medicine and science over the years. And that's meant that they've gotten sicker and that they've died at earlier ages. COVID highlighted that, right? We saw that COVID was disproportionately impacting communities of color, but it's also giving us an opportunity to double down on our commitment to addressing equity and to doing it right for COVID, and then building an equity framework that we can apply to other illnesses as well and to health more broadly. From the beginning of this vaccination effort, prioritizing equity has been, a key feature of our response. And here's what that's meant. It's meant, number one, looking at the numbers, understanding whether we're making progress or not on closing that gap. And the good news is, as you mentioned, Dr. Banks, earlier this summer, we started to see real progress in the Latino community, that we were really starting to close that gap. In recent weeks, we've seen that actually in the Black community as well. That doesn't mean that we don't have more to go, but it does mean that we're making progress. And here's how that progress is being made. Number one, we're certainly working hard to remove barriers to access, right? So that means setting up mobile units all around the country, setting up everything from mass vaccination sites to getting vaccine into doctors' offices so people can have one-on-one conversations and get vaccinated. We early on supplied vaccine to federally qualified health centers, community health clinics in communities, recognizing a lot of people in lower income groups get their care there. And we know that communities of color rely on those community health centers. We wanted to make sure they had access early on to the vaccine. But one of the most important things that we did and that we're continuing to do that we need to ramp up, which is where you can be helpful to us as an organization, is in actually engaging with and supporting trusted messengers in communities. Look, I realize I serve in a position, where I wear a uniform. This is a national position, this position of Surgeon General. But my job is to communicate with the public about, everything related to health. But I also know that there are times where I'm not the best messenger, right? That sometimes what matters is having somebody who knows you, who you trust, who shares your experiences, who understands your background and your lived experience, who can talk to you and say, look, this is what I believe. This is what I've seen. Here's what you need to know. And so recognizing that we need a variety of messengers, really trusted messengers in the community in this effort, we've worked hard to build something called the COVID-19 Community Core, which is now a large network of thousands of organizations, thousands of people all across this country, big organizations, small organizations, but all united in their commitment to help inform their communities about the vaccine and about the broader COVID response. And so one of the things we'd love for you to do is certainly not only be a part of the Community Core, but to take some of the information that we've helped share with people on vaccines and to make it your own, to reach out to your family and friends, to ask them if they have questions or concerns about the vaccine, to help speak up in community town hall meetings, to approach schools and say, do you need somebody to talk to you and to your teachers and to your students and to the parents about the importance of getting vaccinated? We'll step up and we'll do that. Or we'll bring other people and other healthcare providers from the community, and we'll be that bridge that you need to expertise. So if your role in helping to inform communities is absolutely essential. There are people who know you, who trust you because of who you are, because of the respected position of leadership that you serve in your communities. And that means that you have power. You have power to bring people life-saving information at a time where, sadly, as you know, Dr. Banks, better than anyone being a healthcare provider, there is so much misinformation that's out there. And it just, it really bothers me to see that because, one, health misinformation is not new, right? From the time, Dr. Banks, that your mom was, lived through the Spanish flu, we know that there's been misinformation percolating around. But what's different now is just the speed and scale with which it's spreading around the country. And a lot of us, in healthcare, spend our days, thinking about people in the hospitals and our clinics, and we come home in the evening, we're battling misinformation online and talking with our family and friends and helping them to understand what's really going on. So all that just to say that your role as trusted sources of information could not be more timely, more important, or more urgent than right now when we still have millions of people who need to get vaccinated.
Well, this segues into a few months ago, you released a Surgeon General advisory message on addressing health misinformation like you were just talking about. We've seen a lot of reports. In fact, just this morning, I woke up to another person expounding on actually one of our sisters, brethren, talking about some misinformation on the vaccines and also medication. Can you talk a little bit about and dispel the myth once and for all about the ineffectiveness of ivermectin and hydroxychloroquine? And you and I know that ivermectin has been used in parasitic diseases, I'm certainly aware of that. But can you talk just a little bit about the hydroxychloroquine and ivermectin issue and sort of put that to rest once and for all?
Absolutely. And I'm glad you brought that up, Dr. Banks, because this is just one more example of some of the misinformation that's percolating. What's particularly sinister about misinformation is when it's disguised sort of in a form where it seems like maybe it could be true. It seems like somewhat plausible. And then you start seeing it all over your social media feeds, and you think, well, if everyone else is sharing it and talking about it, and I see people taking it, then maybe it's okay, maybe it's safe. But I would caution you against that, because there are these two particular examples, that I'll raise, ivermectin and hydroxychloroquine, are examples of medications that have utility in treating other conditions. But when they've been studied in the context of COVID-19, they just haven't held up. And in fact, we know that with all medicines, there are some side effects, right? And so if you take a medicine that has no benefit, but that has side effects, you're looking at a all downside, no upside scenario. And that's what we've seen is in people who have unfortunately been duped into thinking that these medications are useful. Unfortunately, many of them have suffered some of the side effects and consequences of these medications without getting any real benefit in terms of COVID-19 protection. So I just wanted to say very clearly that there is no evidence that ivermectin or hydroxychloroquine are safe and effective for the treatment or prevention of COVID-19. This has been looked at again and again in studies, around the world, and the evidence is just not there. What is true, though, what we do have evidence, is that there are other medicines that do work. We know, for example, that monoclonal antibody therapies, which are essentially these antibodies are the soldiers that our immune system builds to help fight off infection. And now we have a medicine that has those soldiers, if you will, in a form that can be infused into our body to give us an extra boost in protection. That we know that those monoclonal antibodies really help when they're given early in the course of illness to prevent people from having severe disease. We know that dexamethasone, which is a steroid medication, it's been around for a long time, but that's actually been quite helpful in people who are really sick with COVID in helping to shorten their duration of illness. And there are other medicines like remdesivir, which help. There are other medicines that are being studied that are in the pipeline, some really promising ones that I hope we'll hear more about in the coming months. So the bottom line is there are ways to help if you have COVID. Ivermectin and hydroxychloroquine are not some of those methods. And so just know that, be safe. If you hear somebody who's thinking about taking those medications, thinking it will protect them against COVID, just let them know that there's actually no evidence to support that. In fact, taking these kind of medicines can have side effects and consequences. And if you're a doctor like Dr. Banks, you can speak that from a position of authority. But if you're not even from healthcare, just know that you're raising these kind of issues with people who trust you. It makes a big difference. And we know when we look at polls, about half of people out there say when they're trying to make a decision on things like the vaccine, it's talking to family and friends that makes the biggest difference. So don't ever forget how powerful your voice can be.
Thank you for that. I watch you on television a lot, and I know you have children. And, I really like to hear you talk about your children because it makes it very personal. And thank you for that. So to that end, I know you were listening very intently last week when the information came out about low-dose Pfizer vaccine for children. So can you comment a little bit on where we are with that? And I know you and Dr. Sanjay talk about that all the time on television. So can you expound a little bit on that, where we are and what is it looking like to you?
Well, absolutely. And if you've seen me on TV, Dr. Banks, you've probably seen my kids on TV too, because they tend to jump into my lap in the middle of interviews, not infrequently. And if you can't see them, you can often hear them in the background chattering. They're 3 and 5, and they're absolutely delightful. But like all parents who've got kids under 12, we're waiting, my wife and I, for a vaccine to be available to them, and we worry, about them, right? We know that, thank God, our kids do well overall with COVID, compared to older adults, right? Kids, by and large, will be fine if they get COVID. But we also know that hundreds of children have died from COVID during the last 18 months. We know that thousands and thousands of children have been hospitalized, and that a number have struggled with what's called long COVID syndrome, which are the persistent, ongoing symptoms of fatigue and shortness of breath that sometimes last for months, after infection. So we know that all this to say that COVID is not a benign illness. It's not totally harmless in children. And if you can take a low risk of a bad outcome in your children and make it even lower, we want to do that, right? And that's why some of the precautions that we've been talking about really incessantly, for kids in schools, like universal wearing of masks, regular testing in schools, distancing where possible, making sure we keep our kids home if they're sick. These are all such important measures because, again, we want to reduce risk to our kids. One of the most powerful ways we're going to be able to reduce risk to our kids is a vaccine. And the news that Dr. Banks, that you mentioned about from the Pfizer vaccine was encouraging. The company released a press statement saying that they had their initial results back and they look quite promising for children between 5 and 12. And, of course, that information now needs to be conveyed to the FDA. The FDA has to do its thorough independent evaluation and make sure that the benefits, are real, and to make sure that the vaccine is safe for our children. And they will do that. I mean, I will tell you from my conversations with the FDA that the COVID-19 vaccines are their top priority, hands down. And so they are ready to catch that football, if you will, when the companies deliver that information. And they're ready to process that quickly and thoroughly because they know that our kids need a vaccine, but they also know that parents need to have confidence that the vaccine data has been looked at carefully and no corners have been cut, and that it is both safe and effective for our children. So I think timing-wise, I think we could see that whole process play out within the next couple months and a vaccine available to our kids within that time frame. And then soon after that, we're hoping that kids under 5 will be able to get their data submitted and then later assessed. And you know what this will mean ultimately is it'll mean our kids will have a greater chance of being in school and staying in school because there'll be fewer outbreaks. It'll mean that we can have our kids around grandparents and others without worrying too much about whether there's going to be transmission of infection. And it really just means more peace of mind also for parents and for families everywhere, knowing that you can go to sleep breathing a little easier, knowing that your children are protected.
My last question to you, again, involves a large segment of our population, pregnant women. And although the American College of OBGYN has recommended COVID vaccines for pregnant women, can you just comment on that? Because we still have some physicians in OBGYN who are not recommending the vaccine to pregnant women. So could you just comment on that as we wrap up?
Yeah, I'm really glad you asked this question because number one, it's important to recognize that pregnancy is a high-risk condition when it comes to COVID-19, that pregnant women actually have worse outcomes than people who are not pregnant. They're more likely to be hospitalized. They're more likely to end up in the ICU. They're more likely to experience preterm labor if they get COVID while they're pregnant. This makes protecting pregnant women all the more important. So getting vaccinated if you're pregnant is really, really critical. The second thing to note, though, from a safety perspective, is that there now has been a lot of data collected by the CDC about people who have been vaccinated early in pregnancy, in the middle of pregnancy, and late in pregnancy. And what they found, thankfully, is that the vaccine is remarkably safe in pregnant individuals, that there is no increase in miscarriages or other adverse events, which is really important. We obviously, I've got young kids, and I still remember very clearly the time when we found out my wife Alice was pregnant, and in the months that followed, I felt like I was probably I know out of the two of us, I was the more paranoid parent, and was constantly wondering about what she was eating and what she was exposed to, and I wanted to make sure she was safe. So I completely understand how people want to be absolutely sure during pregnancy that they're safe and that their partner is okay. And the good news is we now have that data. But because we know that pregnancy is a high-risk state, it is so important that we vaccinate our pregnant women across society. And what's worrisome to me, Dr. Banks, is right now when we look at the statistics, the percentage of pregnant people who are vaccinated is actually quite low. And it's even lower when we look at Black women who are pregnant. And so we've got a lot of work to do to get those numbers up. We should, as a society, my personal belief, we should be prioritizing children and pregnant women when it comes to safety, right? This is one of those circumstances where we've got a vaccine that can protect pregnant women. We know that it's safe. We just got to make sure more people know that and that they get vaccinated, because that's how we're going to protect them, and that's how we're going to protect their child.
Dr. Murthy, it has been a pleasure and an honor to be with you this evening. I want to thank you again. You are our trusted messenger. I want to thank Links Incorporated, our president, Kim Jeffries Leonard. I want to thank Michelle Miller, who's been our moderator this evening, and all the other organizations that have been involved. Thank you so much. And Dr. Murthy, keep up the good work, and I'll be watching for you, and I'll be listening for your kids.
Well, that's very kind of you,
on
Dr.
television. Thank you.
I so appreciate that. And well, let me share a couple last thoughts just as we close here. I so appreciate this opportunity to be with you, and I so appreciate what the organization, the Links, is doing, and just your commitment to serve your community during this time of great need. And there is great need, especially for trusted messengers. But I also want to just underline something that I found particularly personally meaningful in your mission, which is the mission around friendship, around building community, around strengthening your bonds with one another. This pandemic has been really tough for people when it comes to their relationships. A lot of people have felt lonely and isolated during the pandemic. A lot of people have also experienced extraordinary stress. And the irony is that during times of stress, we turn often to our friends, our families, the people we trust and love to help us manage that stress. But this has been a time where many people felt like they were isolated from those individuals and were scared to visit, because of worry of getting people sick. So this has been a really tough time. And it's a moment where I believe as a society, we have to really double down on the importance of our relationships and our connection to one another. We have to recognize that our investment in social connection is not just a nice to have. It's actually necessary for our health and well-being. There's been a growing body of research that supports this idea that the stronger our social connections are, the healthier we are mentally and physically. And that could not be more important than right now. So in the days and the weeks and the months ahead, we will have an opportunity as a society to think about how we want to design our lives, how we want to live our lives after this pandemic. And one of the most fundamental questions we're going to have to ask ourselves is, how do we want to prioritize our relationships, our friendships, our families, our relationships with work colleagues? How is that going to fit in to our life going forward? And I'll just tell you that, for me personally, I've come to realize, as much as I've known over the years that relationships are important, I've realized that that wasn't always reflected in how I lived my life, right? That I often put work first, that I fit people in where it was convenient, that I was often distracted, even when I was catching up with a friend or having dinner at the table with my family, because I had my devices with me, and I convinced myself that, work's really important. There's a lot going on. I got to stay in touch. I can't afford to be disconnected. These are all the stories we sometimes tell ourselves about why we put family and friends second and third and fourth in our lives. But one of the reasons I'm so grateful that you exist as an organization is because you understand the importance of human connection. You understand that when our relationships to one another are strong, that we can do extraordinary things. And I'm reminded today of that old African proverb that says, if you want to go fast, go alone. If you want to go far, go together. We're in a moment as a country where we need to go far. We have a lot of ground to cover, whether it's closing that equity gap and living up to the values of our country, that we are going to provide opportunity for all. We have a lot of ground to cover. We got a lot of ground to cover if we want to make sure that everyone has the opportunity at a good education, that economic opportunity is equally available to everyone in our country. We have a lot of ground to cover. And if we want to go far, it means we've got to do it together. So I appreciate you. I appreciate your mission, the spirit of friendship that you bring to your work. And I'm just so grateful that you're there as a partner helping us to get people the right information about COVID, to help them understand how they can protect themselves, and ultimately to help us get through this pandemic together.
Dr. Murthy, thank you, and good evening.
Thank you so much, Surgeon General Murthy and Dr. Banks. That was a powerful and informative discussion. I'm proud that the Links Incorporated is one of the founding members of the COVID-19 Community Corps. As a person of color, the importance and the impact of receiving medical information from other people of color cannot be overstated. To be able to provide our members, our partners' members, and our community members this level of access to America's doctor and a leading infectious disease expert is invaluable. Thank you for lending your time, talents, and expertise to us tonight. Next on our agenda is a parents' roundtable. But before this discussion, please let's take a look at another public service announcement from the Ad Council, which was designed to encourage more people to have healthy conversations about COVID-19 vaccines with people who are not vaccinated.
Scene 1 of 3, take 1.
Taking my vaccine and staying safe. That's what you want me to believe.
Of course.
They're saying that the vaccine is 99% effective, right?
Where are you going with this?
What about the one dude?
I want you to get the vaccine because I care. I want you to be safe. If you was to die, man, that would literally kill me, man.
If it made you feel that way, bro, I'll probably do.
I love you, man. I love you too.
The Black community has been disproportionately impacted by COVID-19. As schools get back to in-person learning, there's a need to hear concerns and share the facts about COVID-19, new variants and the vaccines for parents and the younger generation. With so much misinformation currently being shared in the Black community, it is important to leverage trusted messengers and community organizers to share accurate information with parents and students so they can make informed decisions regarding the vaccine. We are now joined by 5 parents for a frank discussion about their fears and concerns. Let's welcome Andrea Brooks Smith, 30th President of the National Association of Colored Women's Clubs, Cornisha McGill Brown, National President of Jack and Jill of America Incorporated, Rashida S. Liberty, International Grand Basileus of Sigma Gamma Rho Sorority Incorporated, Dr. Derek J. John Robinson, Chair, Grand Strategic Planning Committee of the Sigma Pi Phi Fraternity. And to discuss some of these questions, Dr. Florencia Greer-Polite, Chief, Division of General Obstetrics and Gynecology and Professor of Clinical Obstetrics and Gynecology at Perelman School of Medicine at the University of Pennsylvania. We're going to start this discussion with some of the questions that I know are on many parents' mind. And because these parents have a pulse on what is going on, they're going to ask the questions for discussion. We're going to start with Madam President Brooks Smith. Madam President.
Thank you. As a mother and a president of an organization that focuses primarily on the well-being of youth in our community, what would you say to parents of children in the 5 to 11 age range who are reluctant to having their children immunized?
Thank you guys for having us today, Madam President. It was, first of all, a really great discussion with Dr. Banks and Dr. Murthy. I think Dr. Murthy hit on this really well. And so the first thing that I would say is we have administered 6 billion doses of the vaccine thus far, billion with a B. We know that the vaccine is both safe and effective. I am the mom of 2 children who have been in school for less than 2 weeks, and we have already had to quarantine this year, when last year they were able to safely attend school. And the reason for that is that we know the Delta virus is really a different beast. It is more contagious, and it is really challenging the idea that our children can attend school safely. So what I would tell parents is, yes, we know the vaccine is safe and effective. I hope that parents have taken the vaccine for themselves. And I surely hope that when they have the opportunity to have their children vaccinated, that they will take that. I have a teenager who was vaccinated, and I have a 9-year-old who actually said she wanted to contribute to making this pandemic better for her generation. And she participated in the children's studies to get to figure out what was the actual appropriate vaccine dose. I think to date, she's the only member of our family who's ever been involved in a clinical trial, but she wanted to do that because she felt really passionately about the idea that every person has the opportunity to help this pandemic come to an end.
Wow, that's pretty amazing to be a part of a clinical trial at such a young age. Congratulations to you on raising a child that is so in tune to what is needed for our community.
Thank you, Madam
President McGill Brown, as the national president of Jack and Jill of America Incorporated, I'm sure you have some questions tonight.
Yes, good evening. I first want to begin by thanking you, Madam President Kimberly Jeffries Leonard, for the opportunity to participate in this very important panel discussion concerning COVID-19. As a mother and as national president of Jack and Jill of America Incorporated, that consists of approximately 12,000 mothers with children ages 2 to 19, you could imagine, the impact that the pandemic has had on our organization. And my question is, what initiatives do you think that we can promote in our communities to get more children immunized with the COVID-19 vaccine, really primarily for those who can get it right now? We do know that it will become available later for the younger children, but for the age group who can be vaccinated right now.
I think some of the same initiatives that we have started in our own community to educate parents, right? It's hard to imagine that a parent who isn't vaccinated themselves would actually allow their child to be vaccinated. And so the same way our different organizations, Jack and Jill, the Links, have gone into churches, into communities, into community centers and said, here are your trusted messengers. Let's actually dispel some of this misinformation, and making sure that parents feel comfortable with the idea that this vaccination is not actually that different from the vaccinations our children have already received thus far to go to school. Do we have 50 or 100 years of information behind the vaccines? I remind people that the original mRNA vaccine was actually studied here at my hospital at the University of Pennsylvania over 10 years ago for an mRNA vaccine that wasn't necessarily just for coronavirus, but we do have years of information. We also know from a scientific perspective, there are some things that we need to worry about, and there are some things that are just not scientifically possible. So the idea that an mRNA vaccine affects our genetic makeup is not actually scientifically possible. It doesn't go into the nucleus of the cell. So we don't need to wait 10 years or 20 years to find out about those side effects. Coronavirus is here, it's here now. It's affecting our population and killing our Black Americans at 2 to 3 times the rate of white Americans. When patients say to me, what's the risk of waiting? I remind them that the risk of waiting is that Delta is around the corner, right? And every time that I'm in the hospital, we see that this is now a disease of the unvaccinated, right? That largely the number of people we are admitting in the hospitals and the number of people who are dying from coronavirus right now are the unvaccinated. And so while the vaccine may not prevent us from getting coronavirus, it is preventing us from getting severe disease, from needing to be hospitalized, from needing to be intubated, and from death. And that's a huge, huge accomplishment that we are able to say we've seen now after dealing with this pandemic for 18 months.
Dr. Police, you said a couple of things that are really critical. Been studied at your hospital for 3 years. The Delta variant is right around the corner. And what is the difference in waiting? Death. So thank you for that. I think those
over 10 years. Over 10 years, Madam President.
Over 10 years. So it didn't just come up. And I think that for you to say that really needs to resonate with all that are listening tonight on this town hall. So we have our International Grand Basilisk of Sigma Gamma Rho Sorority Incorporated, President Rashida Liberty, who leads a dynamic group of women who have been at the forefront of advocacy and social justice. And I'm so proud to have served with her in many of those areas. What questions do you have tonight?
Yeah, I think about this, really, I come to the table really twofold. I'm a parent that has health insurance, I have access. And so I was able to make sure that my 13-year-old son was vaccinated by calling his doctor and saying, hey, I want to get him vaccinated. But then I look at leading an organization which has affiliate groups of young ladies who we help that are high school age that do not have the access. These are young ladies that are asking for a ride just to come to meeting to do community service and to really learn what our organization of Sigma Gamma Rho has to offer as our rowers. And so I think about this question and directing it to Dr. Robinson. do you think by having the access in a school setting to receive the vaccine would be a good idea or a good path forward to make sure we do have equity and access for all communities?
Good evening. It's a pleasure to join these mothers on today's call. I certainly think we have to look at all opportunities that are available to get our young people vaccinated. And we certainly know that shortening the distance between the vaccine and the person that needs to be vaccinated certainly helps improve that opportunity. And so certainly as our public health directors and our medical and clinical leaders that are working with our various schools can certainly help lead us in that particular effort. And one of the things that you noted is we have some young people who don't have access to a physician or nurse practitioner or other healthcare professional in their community to help answer some of the questions that they have. And so certainly that's one of the levers that can be pulled. And certainly we know that other efforts to get vaccines out in the communities, in the neighborhoods, in the churches are some of the other opportunities that we can certainly take advantage of.
Well, you know, Dr. Robinson, you have two roles too, just like Dr. Polite. You are a parent, you are a physician, and you are there on the ground, not only having questions yourself, but hearing questions. What are some of these questions and how would you respond?
So some of the questions I hear from parents about getting vaccinated, getting their children vaccinated, they're concerned about, is the vaccine safe? Some want to wait and see, let other individuals, children get vaccinated and see how things go. I've had some parents express concerns for their young women that it might disrupt their menstrual cycles, you know, a lot of different concerns that folks have. But I think Dr. Polite nailed it earlier when she talked about the significant number of individuals, number of children that have died from COVID. You know, more than 500 children have died from COVID. Thousands have been hospitalized. And it's not a situation where you want to wait and see. And I'm a father, and I'm happy to be here talking about a health issue. And I have two sons that are 8 and 10. And so you can imagine dads, you know, boys, they stumble and fall, and we tell them to be tough and get back up. You know, you'll be okay. You're invincible. But the same messages we give to our young men and our children around gun violence, which is an epidemic in many of our communities, we have to deliver that message around the COVID-19 pandemic and the significant toll that it's had. We have to remind parents that Black men, for example, lost 3 years of life expectancy last year, predominantly driven by COVID-19. And now COVID-19 is seen as a preventable illness because we have highly effective vaccines. And so like Dr. Polite, my children were interested in participating in the vaccine clinical trial. And so at 8 and 10, we talked to them about it, and they went in to meet with the infectious disease doctor. They were able to describe to her what a double-blinded, placebo-controlled, randomized controlled trial was. And so they saw the benefit of that is that they might get some protection if they actually got the vaccine. It could have community benefit for young people across the country who also want to get vaccinated, and just really recognizing the fact that we've got to all come together to help move through this vaccine. So I think it's important for us as physicians and as parents to really, you know, not just talk the talk, but we actually have to walk the walk.
Thank you so very much, Dr. Robinson. I mean, your children, I mean, to be able to describe a double-blind placebo trial, I mean, that's pretty amazing. I can't tell you when I learned about that. So they've got a heads up. You know, as a parent, I can relate to all of these fears and concerns that you have expressed, some of which we all, you know, even we've not been able to reconcile within ourselves, and some of them that we've not been able to even verbalize. So thank you so much for being very open and very honest about these. This conversation has generated a number of questions. So we have a number of questions in the chat for Dr. Polite and Dr. Robinson if you want to jump in. But the first question is, what information are you sharing now, Dr. Polite, with unvaccinated people?
So there's a couple of things that have happened. I've been on the front line as an OBGYN for the last 18 months, and we're seeing a number of people who are coming into the hospital for the first time in many months. They haven't necessarily come in for their annual exams. And I think we are making the assumption that anybody at this point who's unvaccinated has made the conscious decision to be unvaccinated. And while I think that is true, it's not a passive decision. We have an opportunity to ensure that people have accurate information. And if we don't actually discuss that when they come in to our healthcare systems, we're quite frankly missing opportunities. So there's 3 pieces of information that I give. I've already shared about the, greater than 95% of patients who are currently hospitalized and dying are in the unvaccinated population. And then the other piece of information that I share is that 96% of physicians are vaccinated. 96% of doctors who have gone to medical school, who have learned about virology, have made the decision to get vaccinated. Dr. Robinson's smiling because he knows we don't agree as doctors on anything. We can't agree on when somebody should get a mammogram, right? But 96% of us are vaccinated. So that should really tell you that we believe that this is the way out of this pandemic. And we absolutely are walking the walk that we are talking to our patients about. I got vaccinated the first week that the vaccine was available at Penn Medicine on December 16th. When I think about that now, I'm in shock that I actually made the decision to get vaccinated so early. But I did that because I did believe that this was an opportunity for me to say to patients, we trust the science and we don't want to tell you what to do. We want you to see what we are doing. And we want you to trust that we're making these decisions for ourselves and for our families.
Walking the walk and talking the talk. I think that is so very important. Thank you. We have another question, and I think that our Surgeon General kind of touched on it. Dr. Robinson touched on it, but can you again address these rumors around vaccination, infertility, sterility? I mean, these are the things that keep coming up over and over, especially in our young women when we talk about vaccinations.
So as I mentioned, there is no, the concept that the mRNA vaccine actually affects our DNA is factually inaccurate. And this, again, is not something that we have to wait 10 and 20 years to see. Men make new sperm every 3 to 4 days. Women are born with all the eggs we ever have. And we ovulate once a month and we lose 1 egg. And then they sort of all crump when we go through menopause. Those eggs are not actually affected by an mRNA vaccine. Our DNA is going to be what our DNA is. So the idea that it's going to change with a vaccine is actually wrong. It does not affect fertility. As Dr. Murthy said, and as actually Dr. Banks commented on, it's no longer suggested that we give the vaccine. It's now recommended that we give the vaccine in pregnancy, because we have seen what pregnant women were not originally involved in the clinical trials, but we've now vaccinated over 100,000 pregnant women, and we have been able to see safety in the outcomes of their fetuses and even the benefits of being vaccinated in pregnancy.
I don't think we can hear that enough. And so thank you for saying that, because I think that is a very critical component to ensuring the safety for our vaccines. We have another question. Are you seeing a surge in a next generation variant that the public should be aware of? Is there another variant emerging, and do the current vaccines cover them adequately?
Dr. Robinson, do you want to take this one?
Sure, I'll hop in. I think probably the most important thing for folks to understand is that variants will occur. Variants will occur with COVID-19. They occur with other viruses. What we don't want to do is miss the forest for the trees. We've got to get vaccinated. Getting our community vaccinated is what's going to slow down the development and the rapid spread of variants. Some variants may be less virulent, and some may be more virulent. That's just the nature of variants occurring. But the most important thing is to get folks vaccinated. I think that the most challenging thing that I've seen lately as a physician is thinking back a year ago, where we were all praying and very hopeful for something to really stop the pandemic, right? Funeral homes are expanding, hospitals overflowing, people dying everywhere, right? And now we have a highly effective vaccines that are available, and we're combating these myths. And we're still seeing people come in sick and people that are dying because they're not vaccinated. That's hard. And I think it's required a lot of patience and resilience to try to meet people where they are and to try to address the concerns that they have. And so one thing that I would add is important for folks who are grappling with it. If you change your mind and decide to get vaccinated, that's okay. You didn't lose an argument or lose a battle. You've got additional information. You had someone like Dr. Polite break it down to you so you could put the myth to the side and make a good decision for yourself and a good decision for your family. That's something we can all embrace and all get behind.
So we have a few more questions. Thank you. This is a question about the booster, because we've been hearing a lot about boosters. how can you determine that you need a booster without an antibody test?
That's a great question. So when we think about boosters, I think about them as we are getting recommendations from doctors about the studies that they've done in thousands of people, not any one individual person, right? So Dr. Robinson commented on this about the variants. We know variants are coming. We understand from a virology perspective, that's what viruses do, right? They look for a new host, and in order to do that, they continue to change. So what we are trying to do as a community and as a society is think of what are the best ways that we can all get out of this pandemic. The way to do that is to protect as many of us as possible. When they looked at when does this protection decrease over time, that's the information that Dr. Murthy was talking about, where he said, yeah, after 6 months, there may be some benefit. And so they're looking at the data and saying who's the most at risk, the immunocompromised, and those of us who are in these situations where we are constantly potentially being exposed to COVID. And so what I would say is that we should go to trusted resources like getvaccination.org, getvaccinated.org, and actually get the answers to the questions that people have. And when the opportunity comes up to get a booster, to take advantage of that so that we can continue to extend our protection.
Well, since you started on boosters, boosters continue to be the questions of the night. What are your recommendations regarding boosters for pregnant patients?
So we have not yet gotten any recommendation from the CDC currently about boosters for pregnant patients. So what we are counseling our patients about is certainly get vaccinated. The majority of our pregnant patients, quite frankly, are not in the 8-month time frame, which is the current time frame that we were using. And so we are telling them to simply watch and wait. But as soon as that becomes available, we're going to offer that at our hospital. And again, we are recommending that they do all the rest of the precautions that we know work too, in terms of PPE, masking. You know, I talk to patients about right now, I think that vaccination and testing has to be a hand-in-hand armamentarium to decrease the spread of this current part of this fourth wave of this pandemic. Any event that has a decent number of people, which to me is more than 25 people, should actually be met with both vaccination and testing.
Thank you. I think that I agree with that. I know that at my neighborhood testing spot, they know me by name. Hey, girl, hey, because I'm caregiving and doing a lot of things in a lot of places. So we got to stay tested. Last question, stay tested. Last question. What is the suggested time between taking the flu shot and the booster?
So I know that they said there was no recommendation that you had to wait between the original COVID vaccine and any of the other vaccines. They sort of took away the wait period. Dr. Robinson, do you have any information? My understanding is that there's not a change.
Yeah, that's the same recollection that I recall, that individuals can get both vaccines simultaneously. Now, as moms, you probably remember when your kids were younger and they got multiple vaccines at the same time. Sometimes they develop the temperature a little fussy. So, certainly people can treat that with, acetaminophen or Motrin or ibuprofen. But certainly we know flu season is coming around the corner, and we're currently dealing with the Delta variant, may have other variants. So it's important that individuals get the flu vaccine as well. And Dr. Polite, I'm sure, joins me in having conversations with people year over year about getting their flu vaccines. Getting the flu vaccine does not cause you to get the flu, just as the COVID-19 vaccine does not cause you to get COVID-19.
Absolutely.
Link Kim, can I jump in here for just a quick second?
Certainly. I was getting ready to I see our resident infectious disease expert shaking her head, Dr. D. Banks. Yes.
Yeah. So just a couple quick points. Number one, yes, you absolutely can get the influenza vaccine at the same time that you get the COVID vaccine. There's no problem with that at all. And the second thing is, last year, we were worried about a twindemic, and it really didn't seem to occur because what was happening was people were wearing their masks like they were, we got our information from the Southern Hemisphere. If you look at Australia and South America, they didn't have a twindemic. And so last year, because everybody was wearing their masks and so forth, we didn't really see the twindemic situation like we thought. This year, I believe that we are going to see it here in my hospital. Over the last couple of weeks, we have diagnosed some patients with influenza, and today we had a patient who's co-infected with COVID-19 and an influenza. So I think it's coming because we've taken our masks off. So you need to get vaccinated. And again, the same time.
Okay. So we've heard it. Get vaccinated, get your flu shot, wear your mask, And we've dispelled a lot of myths here tonight, not only for parents, but for all of us. So I want to take a moment and thank Dr. Polite, thank Dr. Robinson, and thank Dr. Banks and this phenomenal panel. We appreciate your presence, your time, and your invaluable information that you provided to us. Thank you so much. We appreciate it. Now I'm so very pleased to introduce Judy Carmichael Brown, who also serves as the national co-chair of the Links Incorporated National COVID-19 Task Force. She's a member of the Circle City, Indiana chapter of the Links Incorporated.
Thank you, Madam President. Good evening. Since February of 2020, the Links Incorporated COVID-19 Task Force has been meeting weekly to analyze the current data and trends of the coronavirus pandemic in an effort to keep our members and our communities informed. We've done this through email updates, webinars, and town halls such as the one we've hosted tonight. I want to take a moment to recognize the phenomenal women who serve on this task force, along with Dr. D. Banks and myself. Dr. Nikki Martin, Dr. Marcia Bowden-Marche, Dr. Monica Parker, Dr. Regina Miltier-Rock, Dr. Virginia Kane, Dr. Marshalyn Yergin Alsop, Dr. Jocelyn Freeman Garrick, and Attorney Arlinda Westbrook. According to the Kaiser Foundation's latest data from September 22nd on vaccinations nationwide, Black Americans account just for over 12% of those vaccinated. We are still dying at rates of over 2 to 1 and are hospitalized with COVID-19 at a rate of nearly 3 to 1. We challenge all of you to get vaccinated if you've not done so already. And then once you are vaccinated, continue to have these conversations. I challenge all of you to talk to 3 people each week and ask those 3 people to talk to another 3. We cannot continue to have such low vaccination rates in our communities. We're going to continue to pay the price. The health and well-being of our communities across this nation depend on us to not only mitigate the spread, but to ensure the health of our elders and our children and our loved ones. And now, here is another PSA from the Ad Council called College Life. It's inspired by the moments that we all miss on college campuses, which is why getting your questions answered about COVID-19 vaccines is so important.
COVID-19 has changed how we stomp the yard and feel the beat. Now it's time to take the first step that lets us get back to strolling instead of scrolling. Before we can safely come together, we need the facts. As COVID-19 vaccines become available, you may have questions.
Is it safe?
Should I get it? Is it free? It's okay to have questions. Now get the facts about COVID-19 vaccines at getvaccineanswers.org so you can make an informed decision for yourself and for your fam.
All right, what a night. We have had some amazing experts and leaders on the virtual stage this evening. I'm so thankful to each of them and to the Ad Council, the COVID Collaborative, and our partners, the National Council of Negro Women, the Black Women's Agenda, the Joy Collective, Jack and Jill of America, our National COVID-19 Task Force, our National Communications Committee, Dr. Valerie Warlaw, Chair of Events and Assembly Planning, the Links National Headquarters team for making this happen, the Pi Sigma Phi Fraternity Incorporated, Sigma Gamma Rho Sorority, National Association of Colored Women's Clubs, everybody, the Black Women's Agenda, everybody who came together to make this phenomenal night. And I'm sure I speak for everyone in saying that it was such an honor to have the Surgeon General Murthy with us. We are truly, truly grateful for his time. The Links Incorporated is so pleased to be able to not only impact our communities, but transform them. Events like this, where we can talk directly and honestly to our members, our partners' members, and to the members of our community, are vital for the ability to do just that. I hope that you not only enjoyed tonight, but have walked away feeling empowered and informed. I started off the evening mentioning the agency that you have over your life and that you demonstrated by joining us. Please continue to do so. Ask the hard questions, seek the answers you need, embrace the fear and the unknown, because we know we've got to go through it to get to it. So transforming communities, fulfilling our purpose begins with each of us. Our purpose begins with each of us choosing to gain the knowledge and remembering that we are all in this together. Thank you for taking that first step by choosing to be with us tonight. I know that with your help and through informed decision-making, we can all bring an end to this pandemic. Thank you for joining the Links Incorporated, Links in the Know COVID-19 Town Hall with the Surgeon General, and thank you to our partners. Have a wonderful evening.